primarily, the goal of treatment these days is not just to deal with the symptoms, but to really try to get the underlying inflammation to be under control so that the patients don't have symptoms that need to be treated anymore. When we think about treating ulcerative colitis, we think about getting the patient's inflammation under control. We call that induction of remission. So we have a whole spectrum of medical treatments, and they start with very simple things. We'll calm the immune system down and help you get that colitis back under control. And for many, many people, that's all that they need. Sometimes we'll use steroids, and that will help get it under control, often very rapidly, but it has a lot of long-term side effects, so we try to use it for as short a time as possible. Another class of drugs is our immune modifiers. These medications help calm down that inflammatory reaction that's going on. And then we have another whole class of drugs, the biologic therapies, and they work on a specific point in the cascade of signaling proteins that tell the immune system what to do. The only things that the over-the-counter helps us with are symptomatic treatment for some of the symptoms of colitis. But really, in terms of treating the underlying disease process, none of the over-the-counter stuff have really been shown to do very much. Well, with ulcerative colitis, there's not really any cure for the disease except to remove the entire colon.
In surgical management of ulcerative colitis, there are 3 or 2 steps. First step will involve removal of the large intestines and creation of the temporary ileostomy. Then this patient will undergo second step surgery, when we actually remove the rectum and create an internal J pouch. Then, once everything is healed, that will lead the patient to the third stage when we reverse the ileostomy. At that point, the patient will start moving his or her bowels through the anus.
Sometimes patients hear this diagnosis of ulcerative colitis and they think this is the end of the world. The number of people that end up having a colectomy or something like that is extraordinarily small these days. Things have improved dramatically, and the vast majority of people will be totally in remission and happy and healthy and unbothered by this for the rest of their life.